my goodness. So the loudest thunder just happened and the lights flickered and internet went out and all
That's
kinds
how
of
you got the
things.
devil mad at our conversation.
I know, right? What did we say?
Fuck
Because
that.
how like
We just
lightning
convinced 2
strikes.
people to get in the clinic. We just convinced 2 people to get and he mad.
Right. I don't
And
even
they're
know
gonna be
what we
honest about if
say.
they taking the meds. He know he mad. Woo,
Exactly. Faith and mental health, lightning on strike. Like, what is going on? Welcome to Journey to Joy Live, a podcast to promote wellness, resilience, and inspire joy. Be empowered to balance your mental, physical, financial, aspirational, and social health while providing mental health awareness and breaking down the stigma of mental illness in the Black community. I'm your host, Dr. If Joy, and I'm here to help you transform life's challenges into opportunities for joy. Let's begin the journey together. Hello, happy Thursday, everyone. We are in episode 112. Do I really need medication or can I just pray about it? And joining me today as my special guest is Dr. Carmen Black. She is a fellow psychiatrist and she is also an associate professor. Welcome.
Hello, and let me just say, I am so wooed by your whole intro right there. I just gotta wow. Life goals. Ain't that what your podcast about? I got life goals.
Yes, I'll be dancing like, oh, this is a nice song.
Okay, I'm gonna need to know who your editor is because I'm like, darn, I got some work to do.
Oh my God, my editor is me, which is wild.
Okay.
Yes. So tell us more about who you are. You were just telling me you are in Connecticut. What else do you
Yeah.
do? What are you doing? Yeah.
So I am the vice chair of education at the Institute of Living. It's a 200-year-old teaching hospital that's a primary site for Hartford Hospital and the University of Connecticut. I am associate professor at UConn and adjunct at Yale in Morehouse and a partridge in a pear tree.
Right.
I got that fancy glitter, right? I'm doing the academic drab, ain't got my makeup on, which we talked about. I'm just here, right? The title, it's cute, but you got the glow. So let's
Oh, thank
to
you.
each other.
Hey, yeah, I love your energy. Where was that? I think Black Psychiatrists of America. I saw you. You did a talk. I'm just like, I love you. And I met you a couple years ago when I was still at Morehouse. That's right. You came to the graduation. So loving the energy that you have for sure. And you also have 4 kids. There's still a you outside of all this academic roles, right?
That sounds like a mom, not a me. Carmen wants a massage. Carmen wants to read a
Ah.
book. You just named what mom does. Carmen wasn't nowhere in them. Ain't nowhere in those 4.
Oh gosh, right? Yeah, exactly. We carry so many roles and
Carmen
you
need to
are
go to the
full
gym.
on.
What
Yeah,
do you
yes. Yeah. Well, we're gonna talk about all these extra things that we do because we are talking about medication versus prayer and all of the above. And I sent you a list of topics and you picked this one. Tell me what drew you into this topic.
So I am born and raised in the African Methodist Episcopalian Church. My mama is Reverend Dr. Black. I got
Hey.
pastors up and down both sides of the family.
Mhm.
And my mom was one of the first Black women to graduate from a desegregated medical college of Georgia, too. So
Wow.
I've always been at that really fun intersection of medical health and spiritual health and breaking through historical barriers as it relates to historical Black churches. So I had to do it. I had to do it.
Oh, so you've heard a lot because I mean, I've talked time to time on the podcast about like the myths and breaking down the stigma. And of course, one of the things about the stigma of mental health and mental illness and going to see a therapist, being on medication in the Black community is that we're just like, well, pray about it, you'll do better. Or it's not an illness, it's just something wrong with you spiritually that you have to figure out. Go to the church, go to the pastor. So there's always talk about that. But then, of course, there's lots and lots of Black professionals in the mental health field. So we're here for a reason. But,
Yeah.
right? So what have you learned growing up then in the church? And how did you become a psychiatrist despite that?
Oh, I went to med school as a single mom. My daughter was 15 months old, and I was raising her with no paternal support. It was my mama and my grandmama and my brother.
Mhm.
And I started becoming interested in mental health because, I got pregnant. Oops, do pregnant single moms go to med school? Ugh, my family's like, "Well, this one does." So I did.
Yes.
And I was scared because I had a point to prove, and I thought I went to med school for the wrong reasons because I
Mhm,
wasn't nothing about the kidneys. I mean, the heart was cute, but who cared? I was getting real scared because I was learning all this stuff.
mhm,
And then we got to the brain, and then we got to all of the myth and stigma and stereotypes and abuses that went along
mm,
with psychiatry, and when we got to the
mm.
abuses, I was like, "Ooh, tell me more." I remember Googling lobotomies for hours because I was just fascinated how medicalized harm could be so well accepted, and when I started doing that with my lived experience as a
Mm,
Black woman, I was like, "Oh, this field is for me." I loved it. This is so jacked up or so beautifully well. And the line between being completely awful and completely beautiful is so individual dependent.
mhm.
Psychiatry can be beautiful, or if we're validating the reasons why stigma's in the Black community, it can be completely traumatic. And I think
Yeah,
it's important to hold those two realities of the same coin.
for sure. Traumatic, the trust issues, I don't trust anybody or they gonna think I'm weak.
Drapetomania, the runaway slave. Why didn't we just enjoy the plantation where massa was so good to us?
Mm.
Protest psychosis in the '60s, where all of us with the fist in the air must be
Mhm,
psychotic not to accept our social station. So those narratives are there, but there's also this beautiful counter narrative, this
mhm,
beautiful, like, resistance and this
mhm.
beautiful access if you rise above the freckle-knackle.
Exactly, what you and then what's the beauty in it? Let's just jump right into that. What's so beautiful about it?
So, the way I am with you is the way I'm with my patients,
Yeah.
except I probably drop some more curse words, which I won't do. I
Wait,
won't
more curse words with me or with the patient?
um, let's just say Doctor Black gets folks real cozy,
That's
okay?
dope, that's
'Cause,
dope.
like, connecting with a
Yes.
human being is what patients of any background have really just enjoyed with me. So my office is like an HBO special. So if someone come in, "Girl, let me tell you what my baby daddy did," I'll be like, "What? You did
Yes.
what?
Love
What?"
it.
And I said, "Yeah, okay, let's go."
Yes.
Breaking down those barriers is about letting them have a bi-directional, like, communication with a human being.
A human.
My patients know I'm invested in them, and they know they're also invested in coming to see me, and so we have this two-way street that's just a
Mhm.
lot of fun.
Yes, and that's what I like about you, like, then that's how I feel because there's no barrier between the professional me and the personal me. I'm
Mhm.
just the same no matter what. I crack jokes with my patients, whatever, laugh, cry, whatever that's needed at that time, or
Yes.
be sassy, if that person is a sassy person, just whatever, and it's just who I am. And that's what I liked about your talk is that you weren't stuffy like a lot of us, not of us, but a lot of people who do these talks that get up
The ones who
there.
stay in academia, you mean?
Uh,
Yeah,
academia,
yeah.
yeah, not to down
I'm so grateful to
academia.
rise up the ladder with my authenticity. I'm like, "Ooh," looking around and
Yes.
I'm like, "Y'all gonna come for me yet? Oh, we good? Okay."
Yeah, there it is, authenticity, yes. So that's awesome. Now do you have, oh, yeah, yeah, you grew up in the church, so I imagine you're still Christian, you still
I
in
am,
church,
very
all
much
those
so.
things, got it, okay, clearly, because 'cause we're talking about this talk. Now, did you battle that yourself at some point where it's kinda like, um, psychiatry versus spirituality?
In many different ways, it goes up and down.
Yeah,
So, it's really bad, even as a psychiatrist, the
yeah.
internalized stigma of, "Shouldn't I just be praying harder?" to the exact point of your talk.
Mhm,
Because as Black professionals, as Black people, we go through some things,
mhm,
right? We go through some things. Society worked really hard to make sure we go through some things, right? But one of the things I realized is, again, it's very person dependent, but also
mhm,
the initiative that if the first visit or the first person doesn't go well, having that hope and that knowledge that I can try again and somebody's there, right?
yeah,
So think of it as test driving a car. Just because you drive one car doesn't mean you have to stay with it.
exactly.
So lots of folks would be like, "Oh, I went to my therapist and they didn't understand me." I'm like, Who told you have to buy the first car?
Exactly, it's like dating.
Like, you're making a big commitment right there. Imma need you to
Mhm.
try out a couple, and
Mhm.
then we can stick with one. But folks get really downtrodden if they don't connect with the first mental health clinician. I'm just like, "Did you connect with the first car you test drove? Or how about the first house you looked at?"
Yeah.
Right? Looking at a house, trying out a house,
Mhm.
like, you gotta sign up for the mortgage? I don't think so.
Yeah, exactly. That's a really good point, and, it like I said, it's like dating, so it's like, that doesn't mean the first 5 you're gonna sync with, and I know for me and a therapist, I'm looking for Christianity too, I'm looking for Black female Christian therapist, and I did find that, of course, and when I see patients who tell me they're Christian, I said, "Well, hey, you're Christian, I'm Christian, it's okay that we talk about scriptures and things if it aligns with your treatment plan." They're like, "Yeah, cool." Because that is a part of our mental health. Yes, there's a point where maybe prayer alone or your spirituality alone is just not going to cut it when it comes to some major depression or anxiety disorders, but we can continue to include that in your care, in your treatment alongside therapy and medication, and
Yes,
that's
we can.
okay. Yes, that's okay.
I also have a quite different view of stigma when it comes to historic Black populations,
Mhm.
because what I always teach and what I always hold for myself in my office is it stigma if elements were actually harmful? Is it stigma? Right? So
Mm.
if we look through American history,
Mhm.
at the times where psychiatry was in fact misused against Black people, or access
Mm.
was intentionally crafted away from our approachability, right?
Yeah.
So, are the times where, because when I'm trying to encourage, especially church folks, to go try out mental health clinicians more formally, I validate that it can be icky. Like, being Black in America is you
Mhm.
can drink water, but you need a Brita filter, right?
Oh, yeah.
Yeah, informed consumers. Not every part of the water that you can consume. You can still drink water, we're people too, right? But
Yeah.
you have to have that selective informed consent when you go. So
Mhm. Mhm.
try to validate that, yeah, we have reasons why it's not first on our list. We have reasons as a historical people why we turn to the church because those systems were not originated with us in mind in the first place. So, is it really stigma if this system wasn't built for you in the first place?
Yeah.
Is it stigma
Yeah.
or adaptation?
Right, if it wasn't built for us or, like you implied earlier, just, like, if it was, like, basically abuse, like, if we were overdiagnosed with schizophrenia or bipolar and things like that, and that's where the mistrust comes in. If clinicians aren't taking the time to really get to know you, is it really ADHD or is it that I went through all this trauma and you really need to be talking to
Exactly.
me about that?
Mhm. So, but
Yes,
what I'm trying to say is there are clinicians out there who will take the extra step.
for sure.
But there are those who might not. But the challenge was overcoming stigma in historical Black churches, especially as we turn to the church because the systems weren't built for us.
Yeah.
But the church has its limitations. And, what my mom loves to say is the Lord gave us the church, and he also gave us medicine, tools, and they work together,
What I say, yeah.
right? So if we were to get diabetes, goodness forbid, we would pray about our health, most certainly, but we would also hope that we're doing the diet, the exercise, and the metformin, right?
Right,
We
right.
hope we're doing the other things too. And sometimes that normalization is really helpful. Like, hey,
Mhm.
you got high blood pressure, right? Do you pray about it? Yes. But do you take your pill? Yes. Same thing.
Exactly, and you hear those preachers preaching about, "I'm gonna lay hands on you and get that cancer out of you, get that diabetes out of you, get your hyp," but literally, when you leave the church, you're gonna still take your antihypertensive medication, so what's
Mhm,
the difference between that and, "Oh, wait, let me take a medication for anxiety or depression?" Why would it be different? It's the same.
mhm. It is very much the same. And I think that having that language amongst ourselves is the first step.
Yes. Yes, and that's really the reason for this podcast is for us to keep talking about it, talk about uncomfortable things, it's tell you it's okay to not be okay, and when you think about looking back to slavery and thinking about how we turned to the church and turned to spirituality, that's all we had. I mean, maybe they didn't even have access to doctors, right? So that's
Exactly.
all we had was our songs and our culture and praying, so we somehow had to pray things out of us
Mhm.
or we died basically. And so but that's not where we are now. We do have the access. So it's a matter of breaking away from that old way of thinking. And churches are starting to do that, mental health ministries and things like that. So that's cool.
At the peak of the COVID pandemic, my mom, myself, and 2 other Black women psychiatrists, we did
Mhm.
a podcast about how,
Mm.
this was the COVID and the Black churches were closed. And so for the first time in US history, we didn't have that source of resiliency for our mental health, for our coping as
No.
we're burying our loved ones. So at the peak of the COVID pandemic, we held a series of podcasts about mental health during the COVID pandemic. And it was very well attended. It was through the AME church, but, it wasn't all Zoom folks logging in.
Yeah.
Grandma was whipping out the cell phone and was having her grandson help her dial in, right? We had a lot of dial-ins where they access technology, but maybe not the most, video conferencing.
Mhm.
Over 400 people attended. So this idea that the church is resistant or having barriers against acknowledging mental health, that's
Yeah.
not the full narrative. The full narrative is they're very receptive with folks who are trusted sources of information.
For sure, for sure. And I'm gonna actually challenge what we're talking about because for people who believe in prayer and miracles and healing and laying hands and things like that, that's not it's not wrong because all everything that I talk about joy and optimism, positive affirmations, gratitude, all those things, there is healing in, the way you think, right? We always talking about reframing the mind and that's attached also CBT is similar to scriptures that say reframing your mind. We talk
Mhm.
about that all the time. So when you work on your mind and how you think, there is some healing to that. But of course, on the flip side, just sometimes you might need some therapy and medication too. But do you have patients who might say, like, no, I can just pray it away?
Well, it depends on which clinic we're talking about.
Right. True.
Access to mental care can be a great stratifier of what types of patient populations providers get to see. So in my
Mm.
current clinic, I don't actually have a robust gathering of historic Black patients.
Yeah, yeah, yeah.
It's a 200-year-old hospital, so we are aggressively trying to figure out how to earn the trust, but pivoting course in a
Definitely.
200-year journey is a
Mhm.
lot, and gaining
Mhm.
community trust is a lot. At my clinic prior to my current one, I saw a lot of multiply minoritized patients. And, from there, it's a different sort of thing because the ones in your clinic have already passed a barrier.
That's what I was just about to say, exactly.
They've already passed the hurdle. So
Yeah,
it's not quite the whole story to say, do I have patients who want to pray it away? Of course I
right,
do. But
yeah.
they're the ones who already took the step into my
That's why they're
office.
seeing you getting a
That's why
prescription.
they're seeing me. So it's
Yeah.
there in both places.
Mhm.
But I would say most of the times I hear it on Sunday morning. I was visiting a church recently in New Haven, and one of the associate pastors got up and literally said, "I don't need a psychiatrist, Sofa. I need Jesus." And I was like, "Oh, honey.
Yeah.
Oh, honey."
Yeah.
I was like, it was one of those
Yeah.
dramatic, like Hollywood, like,
Yeah.
so getting someone who heard that talk, now we have a trusted leader explicitly promoting this idea that I don't need Jesus. I no, I don't need the psychiatrist Sofa.
Mhm.
I need Jesus. That message was explicitly, verbatim, out loud
Yeah.
spoken to congregants who
Oh,
trust the individual.
wow.
So I think part of what the work we need to do to get more individual patients is to have a conversation with our church leaders,
That's the thing. Yep.
because it's gonna be really hard
Starts
for
with
someone in the
them.
congregation who's on the verge of calling the institution, not calling the institution, calling the back of the insurance card to find a therapist, not calling. Those messages can be really hurtful. So
Mhm.
the message starts with leader
Mm.
time,
For
because my
sure.
heart broke about who is receiving that was on the verge of seeking help for the first time.
And then now they heard that and they're like, "Okay, I just need Jesus.
Right. I'll just pray. Yay. Mhm.
Yeah, but that's yeah, reaching the leaders, the community, the church, because like you said, by the time they come see us, they've already made that decision to maybe possibly be open to medication, and that's
Mhm.
why platforms like this is very important for us to get beyond the one-to-one so that we're talking to the community and letting them see, "Oh, look at that. That mental health professional is cool. Okay, I can go see her."
And that's the
And
work we're doing at my current institution, literally trying to make those connections like, "Hey, can't speak for the first 200 years, but look at this chapter. Like, let's write it together." Right?
yeah. Yeah, and it's on us to educate people about, where mental illness comes from on just on a medical level, a chemical level. And it kind of reminds me of diabetes 1 versus diabetes 2. So you might hear somebody with diabetes 1 who needs to be on insulin say, "Oh, no, 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 I'll get rid of my diabetes by exercise. I'll be fine," right? The exercise is the Jesus in this case. But
Mhm.
then you have to tell them like, "No, that's not how it works. You're literally insulin resistant. You can't just exercise away diabetes 1 the way you can with diabetes 2." So on the flip side, us literally letting them know about the chemical imbalances and the different things go on. Hey, we talked about the brain gut connection last week. Could literally be dysbiosis that's causing your mental health issues.
Mhm.
So there's literally things going on in your body, the stress, infection, different things that could be causing it, or the background, your genetics, lots of different things. So when you just think about, oh, I'm just going to only pray about it once you know that knowledge, it's kind of like, that really doesn't make sense to just only pray about it in that case.
Mhm. Helping folks draw those parallels is really important.
Mhm.
Granted, we got folks who ain't taking their diabetes meds either. Mhm.
That part.
What your A1C is? 14. Oh,
Oh
oh.
my
Mhm.
god.
We have them too. Yeah.
Yeah.
Sister Susie coming in with the with the nerve pain. Sister Susie, can
All kinds of stuff with the foot about to fall off.
not the
Like,
fun.
they already don't believe in meds for the physical, so how we gonna convince them for the mental? Mm.
I wanna put a podiatrist in every church.
Yes, my churches need to do this kinda thing. I mean, I feel like my church is getting there. I mean, we're about to open up a counseling center in our new building, so that's cool. They
That's
kinda use
cool.
me as, like, an on-call person, like, as soon as something happened, I guess I'm that go-to psychiatrist.
Yeah, believe in academia, folks think you're too accessible now. Ha, you
I
lost my
know.
arrogance. Ha,
I know, right?
that's what you get for leaving me here by myself.
Oh my goodness, but I just feel so free.
I get it. I get it.
Nothing against academia, it's awesome, we need researchers. I'm just not that kinda researcher. I'll
Yeah,
research
you
and
know
write.
what I love, and it's relevant to today's talk?
Mhm.
I love academics because of I'm a narcissistic individual, and there's nothing more narcissistic than the ability to turn my opinion into fact.
Oh.
Like a title, right? You should try it, you should try it, you should try it. Now that I got some titles, I can give an opinion, and it's expert now, and everyone's like, "Oh my god,
Mm.
you hear this expert fact from Dr. Black?" I'm just giving my opinion, but it's an expert opinion now, and now I get to go teach the next generation of providers my opinion as expert fact. Now how narcissistic is that? I
Oh, well,
gate
that's a good way to
knowledge.
explain it, if you have the patience.
Mhm, mhm, that
So
gate
in that case, if somebody's watching, they're like, "Okay, doc, well, you're talking about your opinion into facts," if somebody's just like, "Well, what's the proof that I really need a medication?" Where can they turn for that?
I would say turn to lived experience. Find someone who's open about their journey through mental health. That could be Googling, but careful what you Google. But that's again where I say we need to be open amongst ourselves because even us, those of us who do get the formal help, we're not trying to tell anybody.
Oh, that's it. That's a
Like
part of it.
going in the back door in the clinic with our hoodie pulled over and our shades on, hoping nobody sees us.
Keep it
So
a
even
secret.
when we are getting help, lots of us don't wanna talk about it. So, normalizing and celebrating those narratives, the most powerful narrative to get the next person into the clinic is hearing the success story of someone
Yeah.
they respect as a peer.
Yeah, because we all know what happens when you stay silent. I just think about Twitch. I used to follow his dancing, and he's just a great dancer from So You Think You Can Dance, and at 40, he ended up completing suicide, and they were just talking about how happy he seemed on the outside, and obviously not, and, he hid it, obviously, from his wife and kids, and
Mhm,
it's just so sad, and sometimes you might find the wrong person that you might reach out to in church, and I'm not saying don't go to church, but and keep trying. If you continue to reach somebody and they're just like, "No, just pray about it," or, "Oh, you're okay. Nothing's wrong." Maybe that is the time to see a therapist so that they can validate how you're really feeling because it is okay. And you might talk to a family member who's scared of your feelings. They don't really want you to be that way, so they're just, like, pushing you away like, "No, no, no, you're fine, you're fine. All you need to do is this." But it's just that they're scared. So
mhm.
they just don't have the capacity to listen to what you're dealing with. That's where therapy comes in at.
And that's just the therapy part. For bread and butter depression, our colleagues in primary care are leading the way more than psychiatrists could ever have the capacity to cover. So
Mm,
if you're feeling depressed,
good.
in addition to therapy, just mention it to your primary care.
Yeah.
Right? They are so well attuned and their prescribing is actually pretty on point. Sometimes I
Yeah, yeah.
primary care, I'm like, okay, okay, look at okay, okay. If they reach their limit and then the referral comes, like, your bread and
After
butter
the 30, set a
bread,
precedent.
get yourself some Zoloft. Yo, get it while you're getting your metformin and your hypertensive drugs too. Our primary care colleagues can help you with frontline depression too. It's not just about the specialist.
Thank you. Yeah, I'm glad you mentioned that because 'cause they're the front line. They're the
They're
ones
the
that are
front
gonna
line.
see you
Half
first.
of our referrals started at their OB. Their
Yeah, the
gynecologist was
OB.
writing their psychiatry meds till they hit a point.
Yeah.
So, it's not just
Wow,
about
look
the
at them.
psychiatrist. They're pretty on point. I mean, it's hard to mess up Prozac, but still, but still.
So tell somebody, and if you don't have a doctor, a primary care doctor, definitely get a primary care doctor because
Yes.
dealing with other stuff
It's like
too.
a one-stop shop, we good.
There it is. Yeah, and they reach their limit, they'll send you to us, it's alright.
That's it.
You'll be
Hey,
in good
teamwork. There's
hands.
not a the if everybody had to see a psychiatrist to get their Zoloft, we would be swamped. So, all hands on deck. There's no competition when there's this much of a need.
That's right, that's true. Yeah, we need them. I'm
Mhm.
just thinking about that like, "Oh, wait, we'd be flooded."
How many pediatricians handle ADHD and not a child psychiatrist? I mean, if we didn't have primary care, we'd be all up the creek without a paddle.
Yeah,
It's
anxiety,
about the
depression,
primary care, the
ADHD.
frontline folks. Like, you don't have to see a mental health provider as the first entry point. And when you have that conversation with primary care, they'll let you know if there's something more serious going on. Perhaps maybe you're hallucinating, or perhaps, you're hearing things, seeing things, maybe your mood and energy are out of sorts. Like, they'll just have a conversation with any
Mhm.
of your healthcare providers. And Lord, hopefully, Lord, I do all this medical education, so I'm hoping, even if you mention it to your surgeon, I'm hoping the surgeon remembers enough about the type
Oh.
rotation. I know I'm not trying to give too much
They
credit.
at least do a referral. They won't talk to the patient, but they'll at least refer so
They'll
you can
put the
talk.
order in. They'll put the order in. They'll put the referral in. They'll click the button.
Oh my
Shout out
gosh.
to surgery. Y'all know you need to step up. Mwah.
Yeah, I do consults, and I'm like, "Do they talk to their patients?"
Or
I'm
did you
like,
even ask if they wanted to hurt them? You saw them crying.
"Exactly." Yes, exactly, just 'cause someone's crying.
They're crying, sick consult.
Right.
And I'm like, actually,
Oh
that
my
part.
goodness. But
So
yeah, I mean, and on that note, I mean, people say, "Well, why would I need medication anyway?" If it's just like crying in tears, but you're still high functioning and you're sleeping fine and eating fine, maybe you won't need a medication. Maybe you want therapy or to talk to someone to see like what's going on with that. But it's with the social occupational impairment. You're not able to work anymore. Your relationships are messed up
mhm,
or like you said, suicidal thoughts, or you turn into drugs, you're starting to self-medicate. So you're
mhm.
just not yourself anymore. That's when it's kind of like, maybe a medication, but it doesn't mean you got to be on a medication for life. If we're talking anxiety, depression, bipolar schizophrenia, you might need to be on it long time.
might need to have a different conversation.
Yeah.
But hopefully, you'll be in with a lovely human being that you can connect with and sound like yourself when you're describing your experience, and we'll have a talk about it. Come one, come all, we'll figure it out. Let's just figure it out together.
Yeah, exactly. Because 'cause they're not without side effects, that's for sure. I mean, there's no real side effect to prayer other than if you believe that God should have answered your prayer and he didn't, and then you angry at him. I guess you could count
Mhm.
anger as a side effect if that's the case.
You
But,
going today. Okay, phew, okay, Dr. Enjoy. What's up?
I mean, I'm just trying to really
Okay.
think. I just thought about it at the top of the head, like, there's no side effect, but I'm like, I guess that could be. But yeah, with medications, like you said, if you get rid of good psychiatrists, they're gonna make sure you're on the lowest possible dose that is effective. When I inherit patients with like 3, 4 medications or 6 what are you doing on all this? What do you really need? Sometimes they're just going through the motions, didn't really follow up with a psychiatrist all this time, and now they're just still on these high doses. So
Mhm.
find a doctor who's really gonna look at what you're on and, educate you on why you're on the medications and what they do so that you can have an understanding.
To your point, though, folks, please be honest if you're taking the meds, because half the times we get these whopping high doses because they ain't taking it, and we, the providers, are like, "Oh, it's just not high enough." So we upping the dose thinking you taking it. So when you finally do take it for the first time, you get smacked on the face. Then you're like, "Oh, I'm never touching that again. I got a side effect."
Right.
In fact, if you had just told us you wouldn't have taken that, we wouldn't have raised the dose and made you a zombie the next day. So please just let us know. I'd rather you tell me so I don't make full dose. Like, please don't get full dose. Take it for the first time and
Good
then you wait
point.
till next Tuesday. Don't tell me. Like, just tell me. Just tell me. Folks,
Oh,
please.
yeah, that's my number one question, Doc. Are you taking the medication, and how often? And I don't even I basically just assume they miss a day or 2. So I said, "How many days out of the month you think you missed it?" Like, I just ask straight up ask because some of them might feel bad if they miss it or forget to take it, and they don't wanna tell you, so I'll make it a normal thing, like, "How many days did you miss it this month?"
Mhm.
"Oh, no, I take it every day," or, "Oh, yeah, I missed it this weekend because I went away and left my blah, blah, blah." So, yeah, you're right about that.
And there's a lot of times where I lovingly chastise them. I'm like, you know you need this, right? And they'll be like, yeah, doc, I know. So I'm gonna need you to get right. And that's exactly what I sound like. Dr. Carmen Black, I'm gonna need you to get right.
Yeah, and I'll be like, "You know it don't work if you don't take it, right?"
Exactly. But having someone call them out on it. But again, that's that human connection thing, right? So you
Mhm,
can have a
mhm,
conversation. Are you
of
doubting
course.
yourself? Are you having spiritual doubts? Like, what is going on? But I'm gonna need us to talk about it so we can get right.
Yeah, for sure, for sure. You gotta talk about it. And, it's okay to include all the things, we're not saying don't pray and don't go to church and, don't believe in God. But like you said earlier, God created medicine, created mental health, created all these things so that we can be able to add these additional helps for you, additional support.
When my car breaks, Imma pray and take it to the mechanic. I'm just saying. I'm just saying I ain't gonna pray my brake pads back on.
That's a good
We do it all
one.
the time.
That's a good one. You get a flat tire, you sitting there praying.
Lord, reinflate it, please. I mean, if you didn't have a tire, you don't know how. Like me, okay. But we act on these knowledges all the time.
Yeah. Yeah, how about we pray and make sure the doc helps you find a good medication or that the medication works, especially for those, with treatment-resistant
Pray for
issues
a good doc. How
and
about that? Let's hold hands, let's join hands, and together in one accord, we pray for a good doc. How about that? Let's pray for that.
yeah, sit back.
I can join that prayer, and sometimes we need it, Lord knows, but let me get down with that.
Right, right. Okay, well, we lost a little bit of time here, but we talked about a lot of great things, which was awesome. Now, if one last question, if joy was a prescription, what would the daily dose be?
Mm. I would say joy is the greatest form of resistance to all the nonsense history makes us go through. So for me, joy, mm, I love making history mad. Every time I overcome something they didn't want me to do, I'm like, kiss it. So for me, the daily dose would be increments of resistance. And sometimes rest is the biggest resistance you can do. Owning the right to sit down and rest when you know society wanted to keep you busy, keep us stressed,
Mhm.
keep us unhappy.
Mhm.
Sometimes that extra 20 minutes of my cup of coffee, that's joy.
There it is. Resting, resetting, relaxing.
Getting
Yes.
off that rat race. It'll be there.
All right. Well, thank you so much, Dr. Black. I appreciate you. You've already told me you don't have any social media. She does not want you to find her. No, you're just she's in Connecticut doing some big things at
The
4
Lord
different
helps me
universities.
that one.
Huh?
Just for me, I'm there.
Yes.
Social media
Because
can
you
be
have a
so
lot of research that you've done too, if
I
anything, that's
social media can be so toxic,
yeah.
though.
Yeah. Yeah. I used to
Okay,
when I was just doing it for personal reasons, I wasn't on it as much, but now for professional reasons, I'm on it, like, almost
okay, well,
every
how about
day.
call me every time you find something interesting?
Okay, yeah, I'll send you some funny toddler reels. Oh, wait, you don't have toddlers, but that's all my feed is, it's just
9,
toddlers, like,
10,
funny.
11, and 16. I'm
Yeah,
going to a
right.
drumming lesson as soon as we log off with the
There it
teenagers.
is. Well, go do that, go off and be a mom. I
Okay,
appreciate you for coming on the podcast.
thank you for inviting me.
You're welcome.
Have a good one.
You too, thanks. This has been an Enjoy Life production. If you're in a crisis, don't hesitate. Call, text, or chat 988 for immediate support. Please note, this podcast is for informational purposes only and is not a substitute for professional treatment. If you're looking for therapy or medication management through Enjoy Life, visit www.drenjoylife.com to request a consultation. I'm licensed in 12 states. I accept Aetna in Georgia, Florida, and Virginia. Be sure to grab your copy of the Enjoy Note to help you on your wellness journey. Also, check out Inspire Joy for the wife, mom, boss to help you balance it all without losing yourself. Better yet, get the full Joy bundle for just $45. Remember, Journey to Joy Live is every Thursday at 7 p.m. Thank you for joining me, and until next time, may you continue to transform stress into joy.